Prostate imaging. In this video we are going to discuss prostate imaging, asking why is it important, looking at an emerging imaging technique, and discussing some imaging pros and cons. But firstly, what exactly is the prostate? The prostate is a small muscular gland that plays a role in the male reproductive system. The prostate sits just below the bladder in front of the rectum and surrounds the urethra. The gland secretes a fluid that protects the genetic code carried within sperm cells and keeps sperm alive. So why is prostate imaging important? Well, prostate imaging allows for the detection of prostate cancer, which is one of the world's most common malignancies in men. Approximately 3,500 men in Australia died from prostate cancer in 2018 alone, with 17,700 diagnosed. Approximately 1 in 7 men will be diagnosed with prostate cancer by the time they reach 85 years of age. Prostate cancer is the leading cancer currently affecting males. The widespread nature of prostate cancer highlights the importance of effective diagnostic techniques. Due to the slow nature of prostate carcinoma growth and its asymptomatic nature, prostate cancer can often remain undiagnosed. The longer the diagnosis is delayed, the harder it is to treat, and therefore the importance of methods like prostate imaging is emphasized. The early detection of prostate cancer is extremely significant in order for effective treatment to take place. Now moving on to an emerging prostate imaging technique, MP-MRI.
Parametric magnetic resonance imaging, also known as MP-MRI, is an emerging imaging modality that provides the reliable detection of prostate disorders by providing information including tumor location, volume, grade, and stage. As the only imaging modality to provide spatial resolution and soft tissue contrast, MP-MRI accurately identifies distinctions of localized prostate cancers. The development of the Tesla Prisma MP-MRI machine from 1.5 to 3 magnets facilitates a higher magnetic field strength, thus enabling superior anatomical definition and a significantly reduced acquisition time, ultimately reducing streak artifacts such as those from involuntary patient movements. MP-MRI combines T1 and T2 weighted images to detect the presence of cancer. T2 weighted images provide high resolution and clear anatomical prostate structure, where normal zones, due to high water content, have high signal intensity contrasted to potentially cancerous zones with low signal intensities, resulting from an increased density, although this is not specific to cancer. T1 weighted sequences are followed by dynamic contrast enhanced images that use intravenous gadolinium to navigate blood flow, neovascularity, and leaky capillaries for the detection of malignancies. In a study, the sensitivity of MP-MRI was determined to be between 87 and 100% for the detection of a Gleason stage 4 disease. The specificity, however, was determined to be only 40%, a result of benign conditions that can often mimic the distinctions of prostate cancer. Currently, the availability of 3T magnets are restricted, expensive, and MP-MRI machines also require high skill to operate. The ability of MP-MRI machines to detect 93% of prostate cancers compared to the 48% of biopsies will significantly improve the surgical margin, reduce the risk of future reoccurrences, and decrease the risk of overtreatment.
A number of imaging techniques are utilized in the initial detection, diagnosis, and surveillance of prostate cancer. The most common forms include ultrasound, MRI, and PET scans. Each modality provides both benefits and inhibitions in the cancer detection process. Ultrasound imaging is a readily available and inexpensive method which allows real-time imaging of the prostate. It is mostly used in the initial detection and diagnosis of prostate tumors. However, this technique does not show perfect tissue contrast between benign and cancerous tissues. MRI-based imaging, on the other hand, does provide high-quality contrast levels, allowing easy detection and identification of prostate cancers. MRIs are also twice as likely to detect dangerous tissues in comparison to biopsy, so their usefulness in the cancer detection process is undoubted. However, this technique is rather expensive, requires advanced training to operate the machinery, and does not provide real-time imaging. Another modality is the PET scan. PET scans provide detailed information about the stage and character of prostate cancer, making it a highly effective tool in the initial diagnosis and surveillance of existing tissues. While it is largely effective and beneficial, like the MRI, it requires advanced training before usage, it is expensive, and does not provide real-time imaging. Prostate screening as a whole can affect the lifestyle of the patient, causing erectile dysfunction and urinary incontinence. While prostate screening is not 100% accurate, there are cases of both false positives and negatives which can result in stress for the patient and either unnecessary further steps or not taking the steps necessary for further treatment. Studies showed that males with high PSA test results, an indicator of malignancies, may lead to biopsy, which can have a number of complications, including fever, pain, urinary tract infections, and blood in the urine or semen. While the current imaging techniques have been proven to be quite effective, there is still a number of inefficiencies amongst them, so there is still potential for improvements to be made in the systems used for prostate imaging.